Dry eye disease is incredibly common and can be experienced as anything from mild irritation and tired eyes to debilitating glare and pain in the eyes. There are a ton of new treatments that help a lot, but many of them are expensive. So what are you to do on a budget? In today's video, I'll give you my best advice for treating dry eye on a tight budget. Welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so you can have healthy, beautiful, comfortable eyes. Give a little love tap on that subscribe button down below to stay up to date with all the latest eye tips and tricks I have for you. So in 2011, there was a study that aimed to look at the economic impact of dry eye disease treatment in the United States. It's a little complicated to read the result, but in the survey, their analysis indicated that the average annual cost of managing a patient with dry eye was $783 from the payer's perspective. I have to assume that's the insurance company. And that put the overall burden of dry eye disease for the U.S. healthcare system at $3.84 billion. Recently, newer dry eye disease treatments are proving to be even more expensive and not covered by insurance, thus putting the cost burden on the patient for dry eye disease. So in this video, I hope to give you some ways to treat dry eye disease that are friendlier for a lower budget to help reduce your overall expenditure on dry eye treatments. My first piece of advice is to really establish a routine. Consistency is key in so many aspects of life, with dry eye being no different. Carefully evaluating your daily needs in terms of vision is important in determining your individualized dry eye routine. You especially want to pay attention to what times of day you're typically on computer or other devices with a screen. In the morning, it's important to start your day with an artificial tear and any dry eye medications that you take. Then, if you're going to be on a screen, make sure to use an artificial tear before starting your activity and then about every 2 hours while you're using that device. Make sure to take blink breaks throughout and use the 20-20-20 rule every 20 minutes, looking 20 feet away for 20 seconds to encourage you to blink and replenish your tears while you're on devices. My second piece of advice is to take a look at cleaning up your diet. Diet is an important part of dry eye management. In particular, you want to avoid inflammatory foods like fried foods, excessive amounts of sugar, or caffeine. In addition, take a look at the omega-3s you're getting in your diet and consider increasing that as well. You might even consider taking an omega-3 supplement, but be careful looking for the cheapest brand because not all fish oil is created equal and you truly need a pharmaceutical grade EPA DHA content fish oil in order to make a difference in your dry eye syndrome. My third piece of advice is to boost your water intake. A rule of thumb is your body weight divided by 2. That's how many ounces you should consume a day. A 160-pound woman should consume 80 ounces a day. Then do a makeup and skincare deep dive. Audit your skincare and your makeup, determining what preservatives you're putting in and around your eyes. Eliminate or reduce the worst offenders, which I'll leave on screen here. Avoid retinol at all costs, as it has a known negative impact on your meibomian glands. Don't forget to check the description below for a link to all of my free downloads on dry eye disease. Another important piece of advice is to practice what we call computer hygiene. I covered this when talking about daily routine, but what you do while you're at your computer is very critical to how your eyes will feel throughout the workday and then at the end of your workday. While you're on a computer, that 20-20-20 rule can make a major impact on how your eyes feel toward the end of the day. My next piece of advice is to find out what your insurance covers. Because many dry eye medications can be very expensive without insurance or out of pocket, it's important to take a look at your medical insurance. You can even request your medical insurance's drug formulary to find out which drugs they prefer. That way, you'll be able to try the dry eye medication that your insurance includes on their formulary, and you can save yourself and your doctor time by producing that formulary at your visit and showing them which medication you're going to be able to get first. In addition, once you've failed on the medications that your insurance will cover, then medical insurances are usually more willing to approve the more expensive, newer dry eye medications for you. It's called a prior authorization. I made a video about it here, but if you have tried and failed on traditional dry eye therapies, you have a better shot at qualifying for newer medications that come out. If you find out there's a dry eye medication that your doctor recommends but your insurance won't cover, look into patient assistance foundations and coupon companies like GoodRx. Typically, individual pharmaceutical companies will also offer a prescription assistance foundation, and you can apply through their foundation to see if you can get the medication covered. Advanced procedures like plugs and amniotic membranes, some advanced procedures like this are expensive, and if they were out of pocket, they would be very expensive. However, if your insurance will cover those types of procedures, you may start there for the treatment of your dry eye syndrome. And as a bonus in today's video, I wanted to add some of the treatments that I never, ever want you to do it yourself at home. Do not DIY these dry eye treatments. The first is IPL, or intense pulse light. While you may be able to find some over-the-counter IPL options, these are largely sold for hair removal and should never be used on the face, and especially not near the eyes. Gland expression. Another thing I would never encourage you to do is gland expression at home. You might see videos of it and think it looks fairly simple to squeeze that oil out of the glands, but it's very important to first heat up those glands to the appropriate temperature, which is incredibly difficult to do at home. Cold expression of the glands can damage the glands further, making your dry eyes worse. To be clear, what I'm referring to here is purchasing an expression tool and trying to do an expression like we do in the clinic, not using a Newlids device or another similarly marketed dry eye device, which I will talk about in another video and is a good idea for at-home treatment. If you've made it this far and you're not already subscribed to my channel, please hit that button and the bell so you don't miss notifications. That is it for today's iSchool. Class is dismissed. But in the survey